and our Cancer and COVID-19 mini-series, which is an extension of our Cancer Survivorship ECHO. I'm Jennifer Klemp. I know a lot of you on the call tonight, and we have a great list of guests tonight and subject matter experts. Dr. Christian Sinclair, who's a palliative care physician at the University of Kansas Cancer Center. Haley Stolze, who is a exceptional resource at Turning Point and as our resilience program director. New to us tonight, and we'll have each of these individuals also introduce themselves to you, is Karen Dennis Collar, who's a social worker, and she's the new director of psychosocial services at the Masonic Cancer Alliance. Shauna Wright, Dr. Shauna Wright, who's the associate director for KU's Center for Telehealth and Telemedicine, and as I said, myself. So we are very excited to have all of you join us tonight. And just a quick review of what we will cover and how our Project ECHO works. We will do some quick intros. We're going through a little bit of housekeeping, and then we're going to dive into, I think, a very important topic that has been talked about a lot, but I think a lot of people don't really have the tools or the insight to know, how do I apply sort of self-care and resilience in the time of COVID and any type of crisis. We have what we call case discussions tonight, not really case presentations, but we do have some good talking points that we want to integrate in, and then a quick wrap up, and we'll get back to our normal survivorship series next month, focusing on smoking cessation and tobacco in cancer patients and survivors. And that actually does tie nicely into COVID, since we know that a lot of respiratory issues and smoking tend to be one of the biggest risk factors for patients having difficulties with this virus. You will be getting some continuing education credits. Here's our official statements, whether you're a physician, an advanced practice provider, a nurse, social worker, or you just want your certificate of attendance. We do provide that to you through our partners at the Area Health Education Center. And no one has any conflicts of interest except myself, as normal, and that is available to you as well. Here is your double secret code. 42 Fuel will be the way that you will get your continuing education credits. You can do that from your phone by texting. You can log in to your EADS account, or, which would be super handy for future, for current and future attendance, is just go ahead and put the app on your phone, and that way you can always just register, get your credits, and that is a really easy way to do that ongoing. And we will again review that with you at the end, but it's 42 Fuel. We are funded by a cooperative agreement through the Centers for Disease Control and Prevention, through a subcontract with the Kansas Department of Health and Environment, and supported by the KU Cancer Center and the Masonic Cancer Alliance. So thanks to our funding sources. So let's do a little check-in tonight. We have, I think, a decent number of folks that are on, but I would like us to say hi and make sure that we are introducing anyone new on the call. This is a list of everyone who's registered, just to give you guys kind of an overview, and then we're going to stop and kind of go to all of us so we can see who's on the call, and would like to do a few introductions and folks to say hi. So don't be shy, jump on in. And why don't we start with our presenters tonight? Why don't we start with Haley and Karen?
All right, great. Hi, everybody. I'm Haley Stolze. I'm the Resilience Program Director for Turning Point. Turning Point is a nonprofit arm of the University of Kansas Health System. And so I provide evidence-based resilience training to healthcare providers, health system staff, and then we also support community partners and different organizations in the area.
Great. We're glad to see you.
And I'm Karen Dennis Collar, and isn't that funny? 4th day on the job, and you suddenly stumble over, gosh, who was that who just introduced me a minute ago? As Jen said, there's so many new people to learn names of in a 4-day period. So anyway, I started last Friday with the Masonic Cancer Alliance, and my background is in primary care and community mental health. So I'm really excited to be here today, and I hope to not forget Jen's name anytime soon.
Okay. And as Dr. Sinclair just did, he put his hello and his greetings into the chat box. So go ahead and sign into the chat box as well, so we know that you are here, and that's a good way for us to keep track of who's on board and who is not here today. Who else would like to say hi? Carol Bush is back. So you got your technology working.
Oh my gosh, yes. And I could have used, actually, I just told Ashley Spalding, I can use a resilience director today. So I want what you have, Haley, like on steroids. So perfect timing. Who knew, Jen, when you planned this, right? You have a crystal ball.
We need haircuts. You know, there's so much that we need right now. So the fact that we can come together as a community, I think, is really important. All right. Anyone else want to say hi tonight? Dr. Cronin, do you want to say hi? You're on mute. There we go.
Alrighty. Hello. I was just typing it in, so it's good to be here, and I hope everyone's healthy and well.
Thank you. All right. Anyone else want to say hi? I'm not going to force you, but I would love to hear from you.
Hi, this is Hope Crable, and I'm with the Masonic Cancer Alliance. Thanks for offering this, Jen.
You bet. Well, thanks for supporting us, Hope.
This is Vicki Portwood from Coffeyville Regional Medical Center, and I'm glad to be here tonight.
Hi, Vicki. We are glad to see you again.
I'm Carla Van Gotham. I'm usually undercover with the Masonic Cancer Alliance on this ECHO series with Jen and her team. I'm looking to be more involved this session. I'm a full-time paramedic for Kansas City Fire as well.
Awesome. And there's a few other people I haven't met before. Joni, do you want to say hi? Joni Howard. I'm calling people out. If you don't want to, you don't have to, but we'd love to hear from you.
This is Alan Rosen. I am not Joni. I am a hospice and palliative care physician, and I saw this announcement get posted. Definitely an important topic, and look forward to it.
Well, awesome. Well, we are excited you were here, Dr. Rosen, and we have another palliative care physician, one of my co-hosts, Dr. Christian Sinclair. So we are glad to see you all represent. Very good. All right. Well, at any other time, if anyone decides they want to say hi, we would love to hear from you. And thank you all again for joining. So let's go back to our presentation. And hopefully you don't see my messy screen. It's so awful right now. Can you guys see the slides? Or no? Hold on. There we go. Okay. Hold on. There we go. Sorry about that. Okay. We are back in business. We do record these sessions. As you can see, the little red light is going. So just know that these are recorded. We don't have any patient information that we will be sharing. So sometimes when we share cases, we do stop the recording, but that will not be the case tonight, as we do not have any protected health information. Some helpful hints: we do love to see you and hear you, so make sure you're speaking clearly. Please use the chat box. Some of you are exceptional at this. And if you want, and if you are willing, we would love to see you as well. So please go ahead and use your camera. We know some of you might be finishing out your day, so we understand that as well. We do always start with a poll question. This was a way just to get you used to kind of getting engaged in the Zoom platform. And the poll questions will pop up. Then it will give you a few seconds to respond, and then we'll share the answer. And we're going to start with the same poll question we had last week to see if this number has changed, and we'll kind of compare that for you. Do you, at your organization, currently have any patients who have cancer and have also tested positive to COVID-19? And Tracy's going to go ahead and put the poll up. You guys can go ahead and answer. All right. And it's moving. All right. We'll let it keep moving, I guess. There we go. Okay, we can stop that. There we go. And last week it was 60-30, wasn't it 60-30, Tracy, or something like that? Is that right? It was
Yeah, 60-40 on the first week.
40, yep. So we're kind of probably having a different audience today, which is perfectly wonderful. That's what we want is to get additional members. But we do have quite a few folks who have patients who are affected by COVID. And obviously all of us in our work and home and life environments are dealing with the stressors of COVID, which is part of our discussion tonight. So when we jump into this topic tonight of self-care, there's been several recent articles that have looked at both the experience from China, which is the yellow box on the left, and then most recently, just last week, a New England Journal of Medicine article that came out about mental health and healthcare professionals dealing with the COVID-19 pandemic. But I thought the interesting part about some of the things that we're going to be talking about tonight, having to do with HCPs in response to any type of probable trauma that they experience, but in particular, this data is from those who've been caring for patients with COVID across the entire country of China. So depression and anxiety are both impacting about half of all the healthcare professionals that responded to this survey. And as you would expect, that leads to insomnia. But I thought distress, that was exceptionally high at 71%, in that individuals who are working in healthcare and caring for patients with COVID really are experiencing a variety of types of distress, and that really every healthcare professional is having some sort of experience that would benefit from some of the tools we'll talk about tonight. This New England Journal article that just came out last week, once again, sort of highlights that, after we are exposed to any sort of disaster, that most people do have some resilience, right? And I think the interesting part, which we'll learn about tonight and really dive into a little bit more, is that we all need to practice the tools that help make us more resilient. And I think that one thing that we forget, I come from a background of clinical health psychology and more cognitive behavioral training, is that we have to practice mental health every day. It's not something that, we are resilient, so there we go, we're good to go. These are tools that we need to refine, we need to update, and we constantly need to practice. And if we don't do that on a regular basis, when there are times like we're experiencing now, I think that makes it a lot more difficult to really utilize our tools. And so hopefully we'll get a little refresher and really reset that button tonight. And I think the next part of this article really resonated with me, is that education and training on psychosocial issues should be from top down, right? Our leadership, our first responders, our healthcare professionals, everybody needs to have both the education and the training revolving around how we support our psychosocial functioning on a regular basis, but especially in times of crisis like this. So these two articles will be in the toolbox, so please feel free to look at those. And then our last poll question, as we jump into some content, is: are you currently using any type of self-care assessment or program for your cancer care team or yourself? And Tracy will pop up the poll. So this could be any type of assessment where you're doing a check-in, you're using a survey, maybe something's being sent out to the staff, any type of assessment. All right, great. So you can probably stop it there. So the moral of the story is there's not formal processes being utilized. And I think that it's interesting that we do a lot of formal processes for our patients. We use distress screeners. We ask them about their pain scores. But especially in a time like a crisis, we really also need to be utilizing some of those same types of tools for our teams to make sure that we're really keeping a pulse on how they're doing and what resources that they need. Oops, sorry about that. All right. So now we're going to jump in and we'll take some pauses to get you all engaged in the conversation. But we're going to start, and Haley and Karen, you and Dr. Sinclair, you guys jump in to start kind of talking about what do we need to do to start understanding where we are and get kind of right size what our needs are, and how do we talk to our peers and our teammates about self-care. And Haley or Karen, you guys can start.
Okay, I can go ahead and start. So first of all, I always like to start with kind of this acknowledgement of the resilience that's already on this call. You know, I like to say that I don't ever train anybody that's not already super resilient. And so Jen already touched on this, but when I work with healthcare providers or patients, or really any population group, I always like to start with this idea that resilience is not a check the box activity. You know, unfortunately, that's just not the way life works. A lot of us are already very resilient. We wouldn't have gotten through the professional training that we've had or gotten through the healthcare situations that we've gotten through if we weren't resilient. What we need to start framing this as, or thinking about this as, is a value system. And so what are little threads of resilience or little skills that we can kind of thread into our daily interactions, how we process our thoughts, how we take stress into the body? And so Karen and I today are going to talk about a couple pieces of this. First piece is what little short things can you do even while you're talking to a patient or when you go from task to task, as a way to check in with yourself and help your nervous system recover on the go. And then the second piece of it is, you know, the weight of what you all do every day doesn't come without a cost. And so there could be some emotional components that, you know, if you're not able to do those or address those in the moment, valuing that as a check-in that you do, you know, on that brief walk or on your commute home if you're not working from home right now, but finding a time to check in with the emotional side as well. So we're going to cover both of those pieces. But before we get into any other content, why don't we just start by putting something into practice, which is some basic body awareness. So we're going to start even now on this call of putting this into practice. So I want everybody to just kind of participate with me right now, and we're going to do a very quick body scan. So first of all, notice your breath. And I bet many of us have not even taken a deep breath all day long. So I want everybody right now to just take a nice deep breath. I know I have not. I've been breathing very shallow into my rib cage only. So after we've noticed our breath, now we're going to just kind of tune in and notice any place that feels tight or tense. So a lot of times this is the jaw, or it's our neck and kind of the shoulder region. It could be the back or the hips, but see if you can find a spot right now where you've been holding on to some extra tension. And a lot of times it could even be the posture that you're holding. You know, if you're kind of slumped over your computer, or, you know, you're not having that basic body awareness, we tend to kind of hold a lot of stress as muscle tension. So see if you can find that spot where you've been holding today's stress, and then move whatever needs to move. Any good physical therapist will tell you that we all need to do a better job of kind of checking in with our bodies throughout the day. So move what you need to move. And then the last piece of this is, you know, when we do biofeedback training or pain management coaching, we coach people to picture sending the in-breath into the place that feels tight. So for me, it's the top of my shoulders tonight. So I would breathe into those shoulders, and as I breathe out, I would picture letting that shoulder sag a little bit as I breathe out. So you picture easing that tension away with the out breath. So this is just kind of a quick kind of body awareness check that we should all be doing a lot more of, and even I'm guilty of not doing enough of this in my work from home routine. So that's one kind of on the go strategies. I don't know if we need to pause after each of these, or what do you think, Jen?
I think we go through your facets and then we'll pause and get some response. Or actually, why don't we pause here? You bring up a very good point, and see if there's other suggestions that folks have of things that they do during the day that maybe are effective and sort of on the go. I like how you called that. They're sort of your on the go tools that you would take with you. And people can write them into the chat box, but we'd love to hear your voice. Karen has a cat apparently that is helping her with relaxation or stress. I'm not sure.
Yeah, he thought that perhaps right now was the time that I needed some extra attention. So I'll bring him on over. I'm sure we've all had a little extra pet therapy since we've been home.
Yes, pets.
Hey, Haley, I'm curious. For all of us participants on this call, it may have felt a little awkward to do it, especially since we're on display on video. But I know in our palliative care clinic, if we hand them something to say this is how you do it versus actually doing it with them, the uptake is much different. Is that what you see in practice as well?
So are you saying that doing some kind of live coaching is more effective?
Right. If we just hand them and say this is something you should do, that we don't notice anyone come back and say, I'm really glad I did that. But when we actually practice it with them, it seems to be adopted a lot more quickly and enthusiastically. Even if they feel a little bit awkward doing it at first. It's just like we probably felt awkward doing it for you. I guess we should recognize our patients might feel awkward doing it the first time, but the uptake seems to be better for us at least.
Absolutely. So I always demonstrate what I'm coaching someone to do. So I think you're absolutely right. Yeah.
And I think I'll often like speak to that awkwardness, like, oh, hey, we're going to do this breathing exercise. And, if they decide to close their eyes, I'll let them know I'm going to close my eyes too. So I'm not going to be watching you. And that sort of helps to decrease some of that feeling of like, oh, I'm just doing this weird thing. Like we're both doing this thing together. And that seems to make a difference for patients.
I like the idea of having that reminder as well. When you put that slide up and the first thing was the instruction on how to breathe, and you said, some of us probably haven't taken a deep breath all day. My immediate response was, I haven't. And seeing that cued me, but what can we do to cue ourselves, particularly if we have those stressful and hectic days? Is there something that we can do to remind ourselves to check in and do that as well?
That's great.
Yeah, we talk a lot about that in training, and I like people to kind of figure out what works for them because I don't know what your day-to-day looks like, but some common examples are you've got to practice building in cues. Like after I get that email sent, I take a couple deep breaths. We call it take 3. So just take 3 deep breaths. Or if you get up and you're using the restroom or, you've got a second to grab a drink of water, you're pairing that with some nice deep breaths, which then gets your parasympathetic nervous system back online and helps you hit the reset button a little bit.
This is Hope. And at one point we had little round circle stickers just in random places in our house. And when we would see that, it was a reminder to just take some deep breaths and think about it. We'd put them up for my daughter, but that was something that was useful for all of us.
I've actually had people, that's great, like having a visual thing, reminder is helpful. And then also just putting it on your Outlook calendar. I mean, it sounds crazy, but you can do it.
That's great.
For those people in clinic, what are some good ideas as far as, because I think that it's one level of stress when all of a sudden you're working at home, but it's a whole different level of stress when you've gotten super crazy and you may be wearing PPE a lot and things like that. So what are some thoughts about cues in those situations?
So that kind of comes into, might be covered in some of my other slides, but coaching people on self-awareness of the stress response and learning some of those cues of how that shows up in your body. Because until you can kind of be aware of, all right, I feel my heart rate increasing or I feel my breathing getting shallow. Any of these short little tips that I would cover, you could do most of those in PPE. You would just have to first have that basic self-awareness of, man, this is even happening right now. I need to do something real quick here in the moment to bring that parasympathetic activation back online.
Oh, shoot.
They're good points. Hi, Joy.
Sorry.
We love having you, Joy. All right. Those are all great tips. And I think that feeds into your next topic, Haley, where you really go through these facets of resilience and that puts that into perspective.
Yeah, so I won't spend a whole lot of time on this because I want to focus our limited time just on helping you all and talking through, specific examples, but just briefly touch on, so our 10 facets of resilience are evidence-based. They're based on the last 30 years of psychology research on what makes someone resilient, what helps people bounce back from stressful environments, stressful situations. And really what it comes down to, I just said this, but it's about self-awareness, really. Of kind of what your triggers are, what tends to get you pushed into that stress response, and then knowing what to do in the moment to come back from that. And then also, I mentioned this when I first spoke, but looking at resilience as a value system, not just kind of I'm pretty resilient already, I can just kind of move on, check the box. You really have to pay more attention to your emotions, your thoughts, your body as you go through your day-to-day.
Great point. So I like the fact you talk about it as a value system.
Go ahead and move.
Okay.
All right, so another strategy, which, you all heard of how helpful it is to just take a deep breath. We've already practiced that. But when we do our biofeedback classes, we use technology from HeartMath, and there's quite a bit of research on that heart-brain connection and how effective that is at calming the nervous system when you do some targeted kind of biofeedback techniques. And so, again, notice step one here. It's simply about noticing when you start to feel tense, or you might even notice, man, I've been holding my breath. Or, we've all let out those heavy sighs where it's like, whoa, I wasn't even breathing the last couple of minutes. So you've got to first even be aware that that's going on. But then when you notice it, you've got to slow the breath down. All right, so even think about kind of extending that exhale longer than normal. Some people like to count it out. Not everybody likes to do that, and you don't have to count for it to be effective. You need to just settle into a deeper, slower rhythm. And then the last piece of this that is really effective is to call to mind something that makes you feel relaxed. So, when you're gowned up in all that PPE or you're in a tense situation, people might think, oh, well, isn't this gonna, kind of get me out of work mode, or I'm not alert and focused? But the research actually shows that doing something simple like paced breathing or gratitude breathing, you can stay alert and aware, but you're still, that heart rate variability isn't going all over the place, and you're able to calm that nervous system. So you would bring to mind, maybe your pet or your favorite spot to relax, or a specific person that makes you feel supported, whatever it is, and you'd continue to take a couple slow, deep breaths, and that can really have a profound effect. So I don't know if we want to pause there. I can go on.
Yeah, we'll go on, and then we'll keep breathing as we go, because I think that diaphragmatic breathing will come back and you can check in on us and make sure we're doing things correctly.
All right. So this next one is, I'll never forget. Actually, go ahead and click through a couple more times.
Okay.
For some examples. Okay. So I'll never forget training a group of nurse practitioners, and one of them had this revelation of, oh my goodness, I'm already practicing this self-calming technique. And for her, it was as simple as between patients, or when she'd go room to room, she had that 30 seconds or whatever. And for her, it was as simple as taking a deep breath, and she'd say, okay. And so that practice for her was kind of shrugging off or letting go of the stress of that previous conversation, so that she can ground herself in the present moment before she moves on to this next patient. So when we say supportive self-talk, what we're doing is we're continuing to take a deep breath with this, and you might go ahead and click through a couple times. Get some more, there we go. But when you pair that deep breath with a phrase that is relaxing or supportive to you, this automatically trains your brain with practice to initiate that parasympathetic activation, so that you can kind of have that reset moment. And again, this could be as simple as shifting from task to task or patient to patient. Before you go on to that next telehealth call, you just take a moment and say, I got this. All right. Okay. I'm supported. Whatever kind of makes sense for you, just to give yourself that supportive self-talk. All right.
So we can take a pause here and see if people have, I mean, this reminds me, probably some of the others in my generation of, the George Costanza from Seinfeld and the Serenity Now. And so as we say, whatever it is that brings us and kind of refocuses us, that's important. So do other people have sort of mantras or those quick fixes that you use as you need to de-escalate very effectively? Does anyone say Serenity Now? Maybe you do. I actually do sometimes. Yes, other people are shaking their heads. Yep.
Haley, I think that the point of example of the nurse that you gave is really important. And when rounding or even in clinic, when putting on PPE, and it's been a lot more focus on PPE now, but I learned from some of the other members on our team that we actually we decided we'd stop talking while we're putting on PPE instead of continuing to plan and talk and be like, you're going to do this, I'm going to do that, and we're getting on the yellow gowns and the masks and the gloves, and we're still talking and planning. That we actually use that as a little bit more of a silent time to prepare to go into the room. So I think that was something that's been helpful for me in working as a team. I think the other thing is debriefing as a team too, to feel resilient as a team and say, how did that go? And oftentimes what we hear, someone say, I don't think it went too well, and everyone else is like, no, that went great. Like, you did good. Like, hearing that feedback from teammates can be pretty helpful.
And Dr. Sinclair, have you had to have, like, I know that when people start wearing masks and start wearing more gear, are they having to adjust how they breathe within the gear? I mean, is that can cause an anxiety response for some folks too. So how do you coach them as they're putting on masks and they're feeling that little bit of anxiety from the change in their breathing?
Yeah, I don't have any great ideas on that one, because I like even getting fitted for the N95 this week. It's like that's 7 minutes of heavy breathing and talking in a confined space. That was pretty anxiety inducing. So yeah, Haley or Karen. Sorry, Karen.
Well, I mean, that sounds like another good opportunity to kind of coach yourself through, like, I'm still going to be able to breathe, like, even though this is tight and uncomfortable, I actually can still breathe while I'm doing this. And just kind of having that ability to remind yourself of that is probably really helpful. What I liked about what you said a minute ago, Dr. Sinclair, about taking that silent pause as you're gearing up is, that also gives you that opportunity to really connect yourself to the work. And I think that finding that, when a person can do that and find some meaning in, oh, right, I'm getting ready to go in right now and take care of this patient, that also really can make a big impact on us, especially when we have really stressful things happening and there are a lot of things that feel out of our control. When we can kind of focus ourselves on, this is what I'm doing right now, is this care for this patient, and be connected like that, I think it can make a big impact and really help us manage even really stressful situations.
And I do think that communicating with the patient during this, because I have been in the N95s and the whole body suits, and I can hardly speak in a complete sentence when I'm talking to the patient, especially if I'm doing things physically. And I'm always feeling bad for the patients because I'm unable to communicate with them well, and then I'm feeling guilt. So it's easy just to, I mean, it is a joking matter too at that point when you're joking around with your patient, able to communicate with them. That's my way to cope with it, is just being sure to tell them that, oh man, I cannot breathe with this thing on, because it is very difficult to breathe with those on. And then not only are you working on self-care with controlling your own breathing, making sure you don't pass out, then the patient doesn't think there's something totally wrong with you either.
Yeah, that's a good idea. So you're kind of establishing that expectation for the patient to say, this is challenging for me. Just want to let you know that, and that's a good idea. That's great. All right, so Haley and Karen will jump back in. Hold on a second. Let me find, there seems to be a tiny bit of a lag. Okay, there we go.
And Jen, if we're running kind of short on time, I don't know how we're doing on time, I want to make sure that we get a touch on the self-compassion piece. So okay. I don't know if we need to skip ahead to that.
Okay. I do like, there's a couple things here. I do like this, your little check-ins here too. I think this is really insightful.
Okay, so the self-compassion piece, do we have time to talk about that?
Yeah, and then we'll go into kind of a little bit more case discussion, if you will, kind of building on that.
Okay, great. So we've covered just a few kind of in the moment strategies, but and actually the one we're going to talk about here is self-compassion you can do in the moment, but sometimes it's hard to do that, right? If you're talking to a patient or, you're engaged. So this is more of like a deeper reflection to check in with yourself on an emotional level. And this comes from the research of Dr. Kristen Neff. She's out of the University of Texas in Austin and has done a ton of research around self-compassion. And what she's found is that to be more compassionate with others, the people who can be more compassionate with themselves have a deeper capacity for others. And so, but the truth is that a lot of us don't do well with self-compassion. But one thing I was struck by, I got to tune into your last call, and I was so emotionally moved by providers that spoke up and said, we're hit by this tidal wave of information every day, and our patients and we ourselves are expected to keep up with all of this information. And then there were a few other things on the call that were shared where I thought, man, compassion is so central to getting through this crisis. And so this is why I wanted to talk about this briefly. So it's basically a 3-step process. You first acknowledge how a situation makes you feel without judgment. So you do this internally, be like, man, I feel pretty stressed out, or I feel angry after that interaction. Whatever you're experiencing in the moment, you acknowledge it. Then this is where self-compassion is different from self-pity. You remind yourself that you're not alone, that to be human is to struggle. And yeah, this is hard. We're all trying our best to adapt here. So you kind of put it in place or perspective that, suffering is everywhere. And then the last piece of this is, what do I need to hear right now so that I can remain patient and kind and compassionate with myself and others? So again, this is like a self-talk practice. But once you kind of commit this 3 things, acknowledge it, remind yourself you're not alone, give yourself some compassion. Once you kind of commit that, it gets easier and easier to do that in the moment when you notice an overwhelming thought or feeling kind of coming up. Mm-hmm. So I'll pause there.
And I think your point about the practice, I mean, that's something we take for granted all the time. And the practice piece is something that it's hard to pull out the right tool at the right time if you haven't been practicing that tool on a regular basis. So I think that, sometimes we take that for granted because most of us are in functional, work environments where that's just what we do naturally. But when this type of stressful situation, or our peers are stressed, or we're working from home for a month, whatever these situations are, if you haven't been practicing, it's really hard to just pull that out of your pocket and think that you're going to be really acclimated to the new and daily stressors that we're experiencing. And so do people find it challenging to sort of do that practice every day, or is that something that you have committed as part of kind of your daily ritual of trying to do that self-care and practice of your tools? And does anyone have any good suggestions or strategies for the group?
One thing that I think, go ahead. I was just going to say, one thing that I think is really important for us to remember about self-compassion is that it's really easy in the beginning. So if this is a new concept or a new practice, it's really easy to start with noticing when we've been not compassionate and sort of getting on our case for that. Like, oh my gosh, there I go again. I can't believe I'm so hard on myself. What? And then there we go, being hard on ourselves again. And so it can be really helpful in the beginning to just be curious about it and just notice when it's coming up, like, oh, wow, I do that a lot more than I thought I did, because I think that in the beginning, that's what we notice is like, I didn't think I did that, but listen to me, I guess I do. And then to be able to start to turn it around and be able to think about like, what would be a more compassionate way to talk to myself when that has come up.
Well, and you're bringing up a really great point. is in that kind of human nature, we tend to focus on the negative much more than we focus on the positive, right? So as we hear the negative self-talk, that's what sticks. And therefore, as we're thinking about the self-compassion, we have to give ourselves a break as well. And that's a really hard thing to do because we tend to focus much more and much easier on those negative aspects. And I think that as we're looking at the chat box, people are giving some great suggestions about reading or trying to kind of put things into perspective. But that normalization that you guys also talked about is even more important because we all are going to experience these ups and downs. And if we don't right size it with that this is normal, it's okay, and we always think we have to be perfect, that's going to only disappoint us. So I think the normalization piece is also a really great point you guys brought up. Yeah, those are great. All right, let me go back. Seems like every time I go back and I'm trying to toggle, it always wants to go to a different section. So I'm sorry about that, you guys.
That's okay. Well, and Joy put a really good comment up on the chat box, and you can go ahead and advance the slide, that said, when she's trying to be compassionate with herself, that she'll talk to herself like if she was trying to calm a child. And I'll often talk to people about, like, how would you talk to your best friend if the same thing were happening? And pretty much universally, people would say really kind things to their best friend, even if their best friend made a mistake or, did something that they wish they hadn't done. They would say something really nice, and we forget that for ourselves. And so often just that sort of reframe and like Joy talked about, I think can make a big difference.
That's a great point. And Haley, this is a really interesting concept, so I'll let you dive into this.
Okay, and last thing, so this holding two truths at once and then the self-compassion practice I just covered, we have short little 2-3 minute videos that you can share with patients, you can share with your colleagues, and those links I believe will be at the end of this PowerPoint and also probably in your MCA toolbox. But so this idea of holding two truths at once, many of you might already do this as well and not even realize it, but this is something we can also help our families that we live with right now, our kids, our patients. Everybody needs this practice, which is the ability to, again, acknowledge what you're feeling without judgment, but then also see if you can't find a supportive truth to live alongside that stressful thought or heavy feeling. So I've got a couple examples on here. I'm worried about what things will look like in the future, but I know ultimately together and collaborating we'll get to the other side of this. Or this one is really tough for me. I feel like I'm never doing enough. I mean, how many of us can relate to that? But there are some real limitations, even in healthcare, when we're practicing good quality care. Being compassionate doesn't mean we have to get rid of high standards of care. It just means that we notice that even when we're doing our best, we're going to run up to limitations all the time. So it's that idea of knowing that there's always more to do, but also the same truth that I'm doing what I can in this moment. I'm doing what I can control, and that's enough. So I know that's kind of hard to wrap your head around in a quick little session like this, but see if you can't come up with a more supportive truth to live alongside whatever you're dealing with in the moment.
And so do you kind of compare that? It's sort of two sides of the coin. It's okay to have the similar yet different sides of that coin, and learning to live with both of those is sometimes challenging because we have high standards or because we put so much pressure on ourselves. And I think that's a really interesting way to put that frame, is holding the two truths. I think that's a really visual way of thinking about how we hold ourselves to a standard that sometimes isn't very realistic.
Yeah, absolutely.
And I think that one thing that, as we bring this into the conversation, we did want a few of our folks to be able to have sort of a discussion about this in an acute environment. Like, how is this really playing out day to day and in the workplace? So Carla, did you want to kind of describe a little bit about sort of this acute experience and sort of some of the feelings that one would go through from that first responder or that person that's seeing the patient, sort of in the field.
Right, and I think this is a great cue off of Haley when she says that, that feeling like we're not doing enough, because that is something that and I'm sure a lot of providers are feeling right now. There are a lot of different restrictions we're up against now, whether it be PPE or the way that we're caring for patients. I mean, we're all taught to care for ourselves first. We cannot care for anybody else if us ourselves are sick and injured, but that's very difficult when you're watching somebody in distress, that you can't do anything if you are not protected yourself, and that puts some sort of a guilt on yourself, even though we need to keep repeating to ourselves that these are, we are doing as best as we can up against the circumstances. The way things have changed from the little bit of interaction. I mean, they want people to sit behind patients now and not in front of them, so you're not in a direct pathway of their droplets. What kind of communication does that give? Then you have the isolated patient that's feeling even more confused and even more just not feeling quite well about things. Mental health patients right now are really struggling with, because you have a mask on, they can't see your face, they can't see your smile, they can't read your lips. There's a lot of struggles right now going on, having to make certain decisions based on what PPE to use and what treatments are giving, all to protect ourselves, when yes, in the big picture we're all protecting everyone, but guilt is something that is really a tough one. And Haley, you bring up an amazing point, and it's something that I think we've all heard, but we just have to keep telling ourselves is that we're doing everything that we can.
So you brought up a couple good points I want to focus on a little bit more too, is that we connect with patients a lot of times by our facial expressions. Sometimes it's, being able to touch a patient. And so as you think about protective equipment, as you think about telehealth, these are all things we've had to change, right? We have to pay more attention. We want people to turn a camera on so we can get that connection, even though it's through sort of that artificial means. As we think about your own experiences and you're kind of going through these transitions, how has that been? I mean, have you guys had to make different modifications? How are you, connecting when so many of us are hand talkers, visual talkers? We talk with our eyes, we talk with our face. So how is that working for you, and what have you done to sort of address that?
I know it's taken everything I have to not stand 10 feet back and put my mask down and say, hey, I'm Carla, I want you to see my face initially. And then they understand when I put it back on. That's where, I mean, and a lot of my patients that I'm working with are out in the community, so we don't have, I'm not directly working with somebody I know is positive or symptomatic, so we're having to wear our masks with every patient possible. I feel like if I had my mask on right now, communicating with everybody, so people that aren't even suffering from respiratory illnesses or anything, and like I say, especially mental health, when they need to see your face, I stand back, or if I were in the hospital setting, I would stand outside the patient room first. Let them see that I'm getting ready. Let them see, my face, so they know who I am and what my smile does look like and what my eyes and cheekbones do when I do smile, so they can relate to that.
Does anyone else have any suggestions or comments?
We've just been articulating more. This is what my mouth looks like. I am smiling at you. You may not be able to tell that. Trying to make ourselves feel better about our expressionless faces with our masks.
Yep. Yes. And I think some people, at least when people are wearing cloth masks, which is pretty common now just in the clinic, I feel like they're trying to use as colorful of prints and so forth as possible, because that's another way of self-expression. So I think that even getting our wonderful seamstresses who are sewing all these masks, they're really focusing on happy, lively colors, because I think that's another way that we're communicating and trying to connect with our patients. So this is great. And look, you guys are giving great points. Dr. Barr said the hardest part is that you want to give patients a hug. Yes, many of us on here that I know, we're huggers, and that's super hard. And an air hug or an air fist pump is just not the same as an actual hug. And so that's really hard. And especially for our palliative care physicians, you guys are dealing with patients and their families in these, really intense experiences, as are our oncologists. Are there any special tactics that you're using to try to connect, especially with those emotionally charged conversations?
I think for me, it's making sure we're still using silence as a tool. Give room for to come out is when we're in person. It feels even more difficult to me when you're on telehealth. At least you can read the other person, but I find that that's still it takes a little bit more to make sure that you're not just jumping in to fill that digital void, because the silence feels a lot differently with earbuds in.
It does. That's a great point. And Dr. Rosen, did you have any comments? Yes, we'd like to hear.
Yeah, and by all means, feel free to call me Alan. The other thing that I'd also put out there is there are more dimensions to consider than just the patient or just the medical issue of the patient. And so being aware and caring for that individual and how we might respond to it, but also recognize and be open to the needs, who else might be connected to that patient, that person, and expand that concept to the team. Because as everyone is under pressure and certain moments may come up, making sure that you, like you began at the beginning with the poll, taking an assessment or what reminds you not only a check-in on yourself, but others. And that's not just those who are at the same level of you, but those that may be managers, those that may be direct reports, or those that may even be volunteering or may be in a new environment. And so that collective realization can be powerful.
That's a great point. And we did talk, I think maybe in our first session, about how folks are checking in with each other more. We're texting, we're checking in on our peers and so forth. So that check-in behavior needs to kind of continue. And especially when you're in the acute environment, that becomes probably even more pressing. So those are really great suggestions. And I think we need to just be more mindful about how that looks and feels. All right. So, and as you've listed off, so Haley, we'll kind of cruise through these because there is another kind of case discussion I'd like to get to. But your whole point for the ask for help, do you want to kind of do your 50,000 foot of the importance of this? Yeah.
Sure, I can do that piece.
Okay.
So yeah, just really quickly, I think it's easy to sort of think, oh, we just need to power through. This is hard, but I can do this. I'm tough. But I think it's always easier to ask for help early. So, if you start to pay attention to warning signs that, gosh, I'm doing all this self-care stuff, I'm doing the things I can do, or I just don't have time for self-care and I'm really struggling, then I think it can be helpful to reach out, either reaching out to the EAP or reaching out to other resources that your system may offer for you at this time. So, it's good to be talking to colleagues and checking in with each other, like Dr. Sinclair said, but then also, especially if you start noticing warning signs, and, I've sort of listed some of them, if you start noticing that you're having thoughts of suicide or homicide, obviously, if things get that bad, and sometimes they go from 0 to 60, sometimes just life overwhelms us, and it's good to reach out when that happens, obviously. But, when you're not sleeping or you can't get recurrent thoughts out of your mind, or if you start noticing that, gosh, I used to have trouble with a substance, or I used to have trouble with depression or anxiety, or I chronically do, and it's suddenly really getting worse, getting help early for that is especially helpful.
You're really listing off kind of those facets of passion fatigue that leads to burnout, but we're experiencing that in like this accelerated, condensed experience. Whereas many times that compassion fatigue can build over years. This is compressed into weeks. And I think that's an interesting experience as part of what you've described.
Yeah, and the last point I made is, I think it's common in our culture for people to go home and think, okay, I need a glass of wine, or I'm going to have a beer to unwind. This was a hard day. But when you start noticing that you're having more than just one or two, or more than what's typical for you, and that's all you've got to cope, again, that's a good time to be able to reach out and seek some more help in coping.
Absolutely. And here's some of the resources that Haley had listed off. I'm sorry, I screenshotted you sort of right when you were talking in this video, so you're frozen in time. But these videos are really very well done, and they're short. Do you want to talk real quickly about these resources and the videos that you've provided?
Sure. So we've been realizing that this info overload is a real problem right now. So we've been trying to create little bite-sized pieces, which are what these 2-minute videos are. There's some that are less than 2 minutes. So these live here on our Tips for Staying Resilient page during COVID-19. We also have a YouTube channel where all of these live. So we have the 10 facets, but like a condensed version of that, of like, here's a quick way to practice this in that using the 10 facets site. But if anybody has any questions too, feel free to reach out to me directly. Looks like you got my email on there. Great.
On there.
So, yeah, we're just happy to support people, and you're all doing such important work. So thank you.
So then I wanted us to kind of end after talking about those resources with our telehealth refresher, because I think Dr. Wright has been able to bring to our sessions sort of right sizing of what's happening. So I'd like to end with Dr. Wright just sort of summarizing that before we do one last sort of self-care hug to each other. So Dr. Wright, I will turn it over to you.
I'm definitely going to leave time for that hug, so that sounds great. I just wanted to review with you all some of the common questions that we're getting at the Center for Telemedicine right now. And as I walk into that, this is an image that I borrowed from my colleague Janine Gracie at the Heartland Telehealth Resource Center. And I love this image because it really does represent, if we're doing telehealth well and we're doing it right, we think of what we see above ground, that tree that just looks beautiful and it looks like it's doing what it's supposed to do. And we often don't think about the infrastructure or the foundation or the roots of what go into really having a sustainable program that engages our clients and patients and meets all of the needs that we need to have or to meet to be sustainable. So I like to show this image just to remind providers and organizations that there is a whole lot that goes into sustainable telehealth. And if you don't mind going to the next slide, one of our big questions right now is what's going to happen next? We've opened these doors to telehealth. Is it here to stay? Well, telehealth has been around for a long time, and absolutely the response to this pandemic is going to change the face of telehealth. And we're likely to respond to that in many ways. On a human level, we're likely to say, hey, that consumer demand or our provider perspectives are what are really going to make the difference. But the reality is, it's the data and the numbers that are going to really guide where policy goes. So right now, kind of collecting some of that information to give back to our policymakers and our insurance companies are important because there are so many things that go into telehealth that we don't think about. I mean, as providers, we think about what's best for our clients, our patients, what is ease of use, what is access to care, what can telehealth give us. But those who really make some of those decisions look at all of the logistical issues, all of the financing issues, all of the return on investment issues. And so none of us can tell you right now what telehealth is going to be after this pandemic. And it may not move at the speed that we hope. I mean, we were able to really swing those doors open and have really broad application of telehealth in this pandemic. But the policies have not changed permanently. Many of them are set, most of them are set to expire, and we just don't know what's going to happen next. So if telehealth fits for you, if it's a good fit for your patient, doing some data collection, even if that is your patient response to telehealth, is a good idea. So that's what I'll encourage you, and we'll invite you again to our ECHO series. We have 2 more left in the session. I'll put the link for that ECHO in here. Tomorrow, Dr. Stevens is going to discuss the actual patient care piece of telehealth. So we invite you to join us again.
And those have had a really great response. I think you guys are over, several hundred folks that are tapping into that, and then they can watch them if they miss them as well on the website. And Joy Williams has provided us the link in the chat box if you want to copy that out as a quick guide resource. And these are changing every week. It feels sometimes every day. So that's the reason why I think it's so important that we have Dr. Wright continue to update us and you continue to access the website, because these are fast-moving guideline changes, and you need to be able to have a reliable resource to keep up with all those changes.
Thank you.
You bet. So we're going to give you your quick wrap-up with your continuing education 42 Fuel and remind you of our next ECHO, which is about smoking cessation and along the cancer continuum. But I would like us to sort of finish up and let Karen and Haley just sort of give us those last minute, what's our homework? What do we need to do going forward? And how do we, as a group, really focus on our self-care today and then going into tomorrow and for our future? What can we learn and take with us?
Karen, I'm going to punt to you because I feel like I've been talking way too much.
Well, I would just encourage us all, if you have even 2 minutes after this is finished, before you go on to your next task, to just stop and ask yourself, what am I already doing for self-care? Are there things that I need to add to my routine? Maybe some things that you learned about in this, in Haley's presentation, or things that you've used before that have helped you when things are difficult, but you've kind of fallen off the wagon and aren't doing. And sort of see if taking just a couple of minutes to think about where you can thread that into your day or how you can make some commitments. I noticed Hope in the chat box said that she puts it on her to-do list at the start of the week, and plans time in for those self-care things. And so whatever strategy is going to work for you, but I know myself, it's always easy when I finish any kind of a training to just kind of move on to the next thing. And then like a day later or a week later go like, oh yeah, that webinar was really helpful. I should maybe think about that. So that I would encourage us all to do, like after you hit leave meeting, if you have 2 minutes or 10 minutes or 30, to just stop and think about how am I going to use some of the things I learned and what's going to work for me.
And anyone else have any good pieces of homework? We're all obviously overachievers and have thrived in a homework environment. So please share your bits of homework with us.
I like Dr. Rosen's comment, it's not just about checking in with us, it's about creating that culture. And so just, again, tomorrow or whenever the next time you interact with a coworker, just say, how are you really doing? And just kind of try to model what you hope to see in yourself and the culture of the people that you're working with.
That's great. Anyone else? All right, so we are ending with our group hug, our group fist pump, whatever you would like to do. And thank you all for participating. And thanks to our subject matter experts who I think that, resilience is a topic that we all are hardwired, but we need to boost our systems. And so thank you all for participating and engaging. And as we continue through our COVID mania, we need to depend on our teams and our friends and our loved ones and our coworkers. So that's the best way we get through it. So thank you guys. Stay safe, stay well, and we'll see you all next month. All right, bye-bye. Great.